Osteoarthritis. It is the most common type of arthritis that is found in most patients. This is also known as the wear and tear arthritis. This can affect any of the joints in the human body, but it is mainly found in the hands, hips, knees, lower back, and in the neck. This occurs when the cartilage, which is the cushion that at the ends of the bones in your joints, slowly begin to deteriorate. Cartilage is the firm, slippery tissue that allows for friction and joint movement without pain. When the cartilage begins to slowly wear away, you'll get more bone-on-bone friction. With that bone-on-bone, it is more painful because there is no cushion for that bone to hit. Also, when the bone-on-bone begins to hit each other, you'll begin to get more bruises on your bone, which are very painful when they are constantly being hit with the pressure of the bones hitting each other. Osteoarthritis, it doesn't just also affect the joint as a whole. This can cause severe damage to the bone, deterioration of the connective tissue that holds the joint together and attaches the muscle to the bone. Those who are more at risk for getting osteoarthritis are elderly, anybody from 50 and older. The sex, women, it is most commonly found in women. Many researchers don't know why, but most patients with osteoarthritis have been women. Men typically don't get it. Obesity, that extra body weight, adds severe stress to the weight-bearing joints, such as your hips and knees. Also, that fat tissue produces proteins that can be very harmful and cause inflammation around that joint. Joint injuries, such as sports injuries, injuries caused by an accident to that joint. This can also be from old injuries that have been healed. So those injuries from years before to your joints can cause damage to that cartilage and be a big issue and cause for pain in the future. Repeated stress to the joints. So if you're walking, running, standing, jumping, doing any type of movement with your joints over and over again to add that stress to your cartilage, it will begin to deteriorate. It also can be genetic. So you can inherit that gene from your parents or from your ancestors if your parents don't have it. Also, bone deformities. Those who are born with malformed joints and defective cartilage. Lastly, those that can be affected, that are high risk for getting osteoarthritis, are those with certain metabolic diseases, such as diabetes and the condition where the body has too much iron. The symptoms for osteoarthritis they begin to start slowly and they worsen as the time progresses. A few of these symptoms could be obviously pain, which the affected joint might hurt during or after movement of the joint. Stiffness, this is more noticeable after you wake up in the morning and you get out of bed, your joints are stiff, or when the joints have been at rest for a long period of time when sitting or laying down, and you go to use those joints again. Tenderness, when you apply that pressure to that joint or in that joint, it begins to be tender and have a little bit of pain. Loss of flexibility, which you're unable to move that joint at its full range of motion. Bone spurs, which are the extra pieces of bone. These bones feel like just little lumps, but they're not lumps, they're bones. This can be formed around the affected joint. Grating sensation. This is that popping and crackling of your joint when you use your joint. Swelling, when the soft tissue becomes inflamed around that joint. Although there are a few treatments for osteoarthritis, it can't be reversed. The pain can just be released. Some of that is there are some medications that you can take, such as acetaminophen for the pain, or anti-inflammatories to help that swelling. There are therapies that you can do. You can go to a physical therapist and have physical therapy and get exercises to strengthen your joint and muscle. This also will increase the flexibility and reduce the pain in your joints. Or you can go to an occupational therapist and find out ways to do your everyday tasks without adding that extra stress to your joints. Lastly, there are some surgical procedures that you can have to help with the pain. You can get a cortisone injection to relieve that pain in the joint. You can have a procedure of realigning the bone. They will take the damaged side of the joint and shift your weight to the worn out, away from the worn out part of the joint to where you're not having as much pressure on it. And lastly, you can have a joint replacement. They remove the damaged part of the joint surface and they replace it with a plastic and metal part, so that joint is better again. Thank you.